Hello, I'm Lynn Doyle. Thank you for joining us here on Meet the Doctors, where each week we look at important health news, medical breakthroughs, and alternative therapies, and how they may be impacting you and your family. Our aim is to explore the facts so that we can empower you to make educated decisions. Here's what we have coming up for you today. We're going to be talking about bone density. You know, we have 206 connecting bones that protect soft tissue, allow movement, produce blood cells, and stores needed minerals. But so many of us fail to make sure that our skeleton stays healthy. We'll get the upshot from a leading bone specialist and best-selling author on how we baby boomers can have a fracture-free lifestyle.
Bone is very complex and you just can't dumb it down.
And we're also going on an armchair safari with real-life globe trekker Chris Killam. He's better known as the Medicine Hunter. He'll be in our studio to share with us his bounty of natural plant-based medicines. Some of them you can even keep in your own home.
This stuff is the #1 remedy for skin problems in the Amazon. And please give me your hand. All right, see how it's red?
Are you saying I have skin problems?
No, but watch this, watch this.
And of course, we'll have our panel of doctors to answer your email questions. But first, this week's news. British scientist Chris Tomazu already has a pretty impressive resume. He invented the cochlear ear implant, the wireless heart monitor, and the artificial pancreas for type 1 diabetes. Now he's adding a new shade of DNA to the cosmetics industry with an anti-aging skincare treatment. As he demonstrates in this video, his handheld microchip device can sequence your DNA from your saliva, and in 30 minutes, a profile will be ready and an anti-aging serum can be created tailored just for your skin. The technique is called Gene U, and clinical trials have shown that the serum can reduce wrinkles by up to 30% in just 12 weeks.
We all differ by 0.1%, and it's that 0.1% difference, or that error, if you like, in our jigsaw puzzle that my microchip technology is trying to detect. Because those differences tell us whether or not we can metabolize drugs differently, whether we've got different genetic diseases. So this chip, this microchip, will detect those errors in real time.
On a personal level, Tomazu hopes that by creating consumer interest, it will ultimately take the stigma out of personalized medicine. Those air-blown hand dryers in public restrooms may actually spread far more germs than using conventional paper towels from a dispenser. British researchers placed a harmless type of bacteria on the hands of volunteers in order to simulate poorly washed hands. They then had them use jet air and warm air hand dryers or paper towels to dry their hands, and then they measured airborne bacteria levels. The cold jet air dryers were by far the worst. Bacteria levels in the air were 4.5 times higher than around the jet air dryers and 27 times higher than around paper towel dispensers. It seems like carrying a bottle of Perel might solve some of those problems. Sierra Leone is now bearing the scourge of the 8-month-old Ebola outbreak. In the other hard-hit countries, Liberia and Guinea, the World Health Organization says infection rates are leveling off or even declining. But in Sierra Leone, they're soaring. The country has been reporting around 400 to 500 new cases each week. It's also been dealing with cultural issues. You see, the touching of dead bodies is part of paying tribute to the deceased, but it also is responsible for as much as 50% of all new cases in which bodies of Ebola victims are extremely contagious. And speaking of another global virus, this week marked World AIDS Day and another year in the fight against HIV and AIDS. More than 2 million people globally became newly infected with HIV, and 1.5 million people died from AIDS-related causes. However, the number of new HIV infections and AIDS-related deaths has dropped by more than 1/3 in the past decade, largely because of advances in HIV prevention and greater access to antiretroviral therapy. President Bill Clinton said it best in a recent speech in Melbourne, Australia.
The AIDS-free world that so many of you have worked for so long to build is just over the horizon.
Remember this sound?
You've got mail.
Well, now it seems emails have become a 21st century ailment. You know what that is, the urge to instantly reply to hours of office emails and text. And as many of us in high-pressure jobs can attest, such behavior can cause you to sometimes burn out. Our own Newsmax deputy health editor, Nick Tate, is here to help us sort it all out. Hey, Nick.
Hey, Lynn, you know,
Personal technology has certainly improved our lives in countless ways, of course, with smartphones, tablets, and laptops providing instant access to news and information that helps us live better. But being plugged in 24/7 also has some huge downsides. Now, this new research out of Northern Illinois University shows that people who feel compelled to respond immediately to work-related emails are actually less productive on the job and more likely to burn out. The researchers also found that people who have a hard time unplugging from work on weekends and while on vacation are also far more likely to feel tired and overwhelmed at work. They have trouble sleeping at night, thinking clearly, and ironically enough, they even tend to call in sick more often. You know, the bottom line here is that communication is key, and let me just say, Lynn, that I'll try not to send you an email or a text message about this issue.
Well, if you do, I'm ready. I'm ready to hear from you, Nick. Thanks so much. We appreciate that report.
No rush.
Actually, during your report, I was answering a few work emails myself. Okay, we're going to take a quick break, but when we come back, you know, we don't often think about our own bone health or developing osteoporosis, but maybe we should be thinking about it a little bit more. Coming up next, we're going to find out how important bone strength is to us and what we can do to protect ourselves. Stay with us. Meet the Doctor continues right after this. Welcome back to Meet the Doctors. I'm Lynn Doyle. Here's something you might not know. The human skeleton has 206 connecting bones. It protects soft tissue, it allows us to move, it supports the body, it produces blood cells, and it stores much needed minerals for the body. So should we be making sure that our bones get protective screening just like other parts of our body? Well, Dr. Lonnie Simpson, author of Dr. Lonnie's No Nonsense Bone Health Guide, says absolutely yes, and she's joining us to talk about how we can enjoy a fracture-free lifestyle. She's Skyping to us from her home in California. Dr. Simpson, it's nice to have you with us.
Oh, it's great to be here. Thank you, Lynn.
Would you say it's a fair assessment that most of us probably take our bones for granted?
Absolutely. You know, the bones don't really let us know they're even there, frankly, unless there is something wrong with them or if we get a fracture.
Why is it so important that we make bone health a priority?
Well, 80% of our lifetime bone mass is laid down by the time we're 18 years old. So it's really important, especially for the younger set, to get a clue, or certainly for their parents. And by the time we're 30, we're not really actively building bone, and it becomes more difficult to build bone. So by the time you reach 40, 50, and 60 in every decade of life, it's much more difficult to actually build bone density. Now, there's another thing that we'll talk about called bone quality that's a little bit different in this whole picture about bone. But the fact is, we really all should be concerned with this bone structure.
What is bone mass?
Well, bone mass, typically we're talking about really the bone density, how dense bone is. And we have a picture of that. And you can see that on one side there's a real density to the bone. And the other side has almost like it's looking like Swiss cheese. It has holes in it. So when we're looking at the total bone mass, we're really looking at the bone density. And this is what and how right now we are diagnosing osteoporosis, or whether or not somebody is at risk for osteoporosis, is looking at the bone density.
What can we do to build bone and have stronger bone quality?
Well, it goes back to the question of, okay, let's look a little more deeper into the business of what is bone quality. So bone quality, we can also say, is a healthy bone has some flexibility and it has strength. So calcium and phosphorus, for instance, help have the bone have that good strength. But the quality is that collagen or the flexibility. Now, as we age, that flexibility begins to deplete, and the older we get, it can deplete and even more. And depending on what we eat and how good our digestive system is, and whether or not we exercise, will hasten that process of us not having enough of that flexibility in the bone. And now let me just say too, Lynn, that there certainly are genetics with this. There are collagen disorders and a lot of other things, but I don't care what condition somebody has. My position is that nutrition, gastrointestinal health, and exercise should be the core treatment program. And if we need medications on top of that, I'm glad they're there.
Okay, having said that, then who is at risk for developing osteoporosis or even borderline osteoporosis, which I believe you were diagnosed with at the age of 45? Who's at risk for those things?
Okay, well, I didn't do my adolescence very well in terms of my bone. So I started smoking cigarettes at the age of 12. I ate a lot of sugar. My diet was really poor. I wasn't exercising in my teens. So I didn't build up a good bank account. So then when I hit menopause, which I went into at 46, I was much more at risk because, well, I also had small bones. That was also true. But the fact that I did not build up a good bank account of bone was because of what had happened years earlier. Now when I hit menopause, the estrogen, ups and downs of estrogen, a woman can lose up to 20% bone density in the 5 years starting before menopause and up to even 7 years after menopause, which is why I want to get a hold of these women earlier so that we make sure that we get rid of any gastrointestinal problems, get them off the antacids if we possibly can. That's horrible for bone.
Okay.
And do what we can to get the bones what they need. The bones need protein, for instance. I see a lot of patients, a lot of older folks in particular, who aren't getting enough protein. Or maybe they're not digesting protein because they're on proton pump inhibitors or these other antacids. And guess what they do? They keep our bodies from making stomach acid. Well, what does stomach acid do? It breaks down protein and it gets calcium into the system. So I'm not telling anyone to stop taking these medications. But what I am saying is that a lot of people, in fact, can get off of them with the right guidance and working with a nutritionist. Because a lot of times when people have GERD or the gastric reflux, these acid problems, it's because of a horrendous diet.
Okay, so in summary, you would say that we need to stop those bad habits, we need to have good nutrition, exercise is always helpful, and they should get a test and follow doctor's instructions.
Absolutely.
Dr. Lonnie Simpson, thank you so much for being with us. Great advice. I hope people will heed it. Up next, he's been called part David Attenborough, the British naturalist, and part Indiana Jones, but actually he's a real-life medicine hunter searching the globe for natural remedies. We'll meet him when Meet the Doctors continues. You know, it's a jungle out there, and that's just the way Chris Killam likes it. He's known as the medicine hunter, and he travels the world looking for plant-based medicines to make you and I feel better. Nick Tate joins us once again to tell us a little bit more about Chris Killam.
Well, hey, Lynn, you know, Chris Killam really is the Indiana Jones of natural medicine, and instead of hunting for archaeological treasures or adventure, Chris has spent a lifetime traveling the world in search of medicinal plants that can hold the keys to better health and longevity. He's worked with many major companies and health-based organizations to develop, popularize, and market traditional plant-based food and medicinal products, many of which has been used for thousands, hundreds of years. Now, if you've read any of Chris's books, you know that he's driven by the belief that Mother Nature offers really the best prospect for new treatments and therapies, and it's hard to argue with him. Even the world's pharmaceutical companies are taking notice and recognizing the enormous potential of plant-based treatments. According to the National Institutes of Health, for instance, about 140 new drugs have been developed from Chinese medicinal plants alone in recent decades, including new treatments for leukemia, hepatitis, dementia, and even malaria. Now, in many cases, plant-based drugs also take less time and they cost less money to develop than medicines that are synthesized in the lab. And people who know the business will tell you that plant-based medicines really are a growth industry. And I think it's fair to say that Chris is really one of the pioneers who's out there, quite literally in many cases, working in the field.
Thanks a lot, Nick. And guess what? Here in our studio is the medicine hunter himself, Chris Killam. Also joining us is Dr. Erica Schwartz, who specializes in bioidentical hormones, which often can use botanicals as well. Nice to have both of you with us.
Thanks.
So,
Pleasure to be here.
You go right back to Mother Nature. We came from the earth, and you think that we should get our treatments from the earth as well.
Well, we have gotten our treatments from the earth for all of history up until about 1940. We have thousands of medicinal plants that are lifesavers, that are the basis of modern pharmacy, that are used widely in hospitals all over the world. So yeah, I'm totally in favor of keeping that trend going.
And why do you think it's better for us to use a plant-based medicine as opposed to something that is prescribed to us from the pharmaceutical industry?
Well, to start with, we've co-evolved with plants, so we metabolize their compounds. That doesn't mean that there aren't toxic plants. You wouldn't eat poison ivy. That would be a bad move. But we've co-evolved with plants. We know how to take them into our bodies and utilize them. We and plants are virtually inseparable on this planet. Plants are safer medicines. Every year, about 200,000 or more Americans die from the proper use of over-the-counter and prescription drugs. Most years, not one American dies from herbs. They have a longer history of use, and they have as many scientific papers published as drugs do.
Are we finding that traditional physicians are now starting to incorporate botanicals into practice, or is there still some question about whether or not this is the proper way to go?
Well, if there's any question, then it means they don't know anything about history. Because actually, all of pharmaceuticals is evolved from plants. So if you think about the Jackson, the digitalis plant, sure. Or you think bioidentical hormones when you're talking about, they come from yam and soy. And actually, the whole chemistry that developed, the whole chemical evolution of pharmaceuticals came out of plants. And they're still using plants, only they use in the lab ways in which they just change a little bit of a molecule, even though it's from a plant, so that they can get a patent on it, and then they can sell it for a few $1 billion for the drug companies. They're not helping you and me, they're helping themselves.
And
Okay.
that's what creates toxicity. You
Of
tinker with the
course.
molecules, the metabolism changes, you've got a
Exactly.
poison.
Okay.
Of course.
You heard Nick say that some of the plant-based medicines that you advocate have literally been used for thousands of years.
Oh, yes.
Can you give us an example of something that we might be able to use that is easy to get
Ginger.
and not going to
Ginger
cost a
root.
lot?
It's been used in traditional medicine for several thousand years. It's available in every supermarket. In human clinical studies, it proves to be every bit as effective for motion sickness as Dramamine, but more effective when you're seasick. It's good for treating colds. It kills the rhinovirus that causes colds.
What do I do with
this?
this?
You can grate it and you can drink a tea
Can
out
I
of
just
it.
carry it around and
You
keep
can
the
also
cold
get
away?
ginger chews, which are these kind of pleasant candies that are like super infused with ginger extract. But this is a great medicine.
I see something here that every kitchen probably has.
Garlic, garlic, potently antibiotic, very good for thinning the blood, reducing triglycerides, reducing the risk of atherosclerosis, hardening of the arteries. Excellent for keeping away vampires, of course. There are a lot of studies that show benefits of garlic, including reducing high blood pressure.
Can I ask you about a drug, or not a drug, excuse me, a plant that is now starting to get very popular? It's ayahuasca?
Ayahuasca is a combinatory psychoactive liquid potion made in the Amazon that tastes disgusting, that sends you on basically a psychedelic journey for several hours. This is the key component in making ayahuasca, this vine, and it is
Looks
now...
like a stick from my backyard.
Well,
Probably have it on your backyard.
it shows benefit for illnesses that do not respond to conventional treatment, especially post-traumatic stress disorder, people who've suffered violent and sexual abuse, headaches of unknown origin, backaches and stomach aches of unknown origin. I've seen several hundred people recover from things like chronic fatigue, skin conditions that wouldn't go away by drinking ayahuasca. It's mysterious. We don't understand everything about how it works, but scientists are diving into that.
And that's really what kind of puts people off a little bit, isn't it? When they're not quite
But I think
sure
it's a
what to
problem,
expect.
Lynn. I think this is the problem. The problem is that as a conventional doctor, we're trained that you have to give somebody a pill for a particular problem. The reality is that if you're taking an herb, you're going to affect, or a supplement, it's going to affect everything. In medicine, in conventional medicine, the medication has side effects. And that's the problem that we don't want to hear about. Plants have side effects. They affect everything, and they probably do it a lot gentler, a lot better, and a lot safer.
I have to say I'm intrigued by what's in this tiny, tiny little bottle. Can you explain this one?
This is a blood-colored tree resin called Sangre de Grado, and forgive me for reaching for my knife, but I can't get this off without it. This stuff is the #1 remedy for skin problems in the Amazon, and please give me your hand. All right, see how it's red?
Are you saying I have skin problems?
No, but watch this, watch this.
It is red.
Blood red, not anymore. Now what'll happen is you have a thin latex bandage. Let's say you had a cut there. This is antibacterial, antiviral, and antifungal, anti-inflammatory, so it kills the bad stuff in a cut and a wound. It makes a little latex bandage over it to protect the skin. It's a rapid skin healing agent.
Could we put some here where I cut my finger on Thanksgiving?
Absolutely, absolutely, for sure, right there. And then you just rub that on, just rub that with your fingertip, and you'll see it'll eventually go from blood red to white. Okay, we have like a little dermatology clinic here.
Let's do that. Perfect.
Let's do this. Let's do this right.
Yeah.
Yep. Okay.
So what is it? I mean, is it a plant?
It is the sap of a tree. So you go up to the tree and you strike it at a diagonal with a machete. It starts to bleed this blood red sap.
Like maple syrup.
And yeah, like that. And this is everybody in the Amazon knows you get a burn, a bite, a sting, a cut, an abrasion.
Amazing.
You go to one of these trees, you slash it, and you take the blood and you put it on.
We have to take a quick break, but I know people are going to have questions about this. Will you stay with us?
I'll have answers.
Oh, good. And of course, Dr. Erica, will you stay with us as well? We'll answer some of our viewer email questions. We'll do that right after this. I'm very curious to find out more about this plant-based medicine thing, so I know you are as well. Stay with us. We are back here on Meet the Doctors. I'm Lynn Doyle, and I'm joined in this segment by the medicine hunter himself, Chris Killam, who we just met, along with Dr. Erica Schwartz, who specializes in bioidentical hormones. We're going to take this opportunity to answer some of our viewer emails. You promised that you would have answers, so we're going to put you on the spot.
I have answers.
But
They may not be the right ones, but I've got them.
I have a few questions before we get to them. I need to know about some more of these items that you brought and how they would be beneficial to the people who are viewing.
Well, this is Tonkat Ali. This is actually a root of a tree from Southeast Asia. This enjoys a number of human clinical studies for enhancing erectile function. And
I just introduced it like this.
Right. Yes, I guess the thing is to hold it up like this.
That's right.
And also for boosting libido in both men and women. So this is a profoundly beneficial herb, and it does not cause blindness, deafness, heart attack, or stroke like some other agents that also improve erections.
I know that you deal with bioidentical hormones. Can you explain for us what they are?
Bioidentical hormones are the same hormones your body makes when you're young, healthy, have a high libido, are fertile, and you don't get sick. And that means estrogen, progesterone, testosterone for both men and women, because we all have it. It's also cortisol, it's also adrenals, all other adrenal hormones, thyroid. Those bioidentical just is a marketing term that is used to describe hormones that are made to be identical to the hormones your body makes. That's it. It's really nothing big, nothing unusual, and certainly nothing new.
So having said that, you actually use botanicals similar to
Well,
these?
I don't use that one, but maybe we should.
Well, this specifically increases your body's production of testosterone. So it's actually, it has some anti-aging benefits in terms of skin and lean muscle mass, as well as energy and mental health.
Right, because what I actually do is pretty much, it is anti-aging and prevention. Because you know what? I don't want to bash pharmaceuticals completely, because I ran a major trauma center in my first part of my career, and I think that pharmaceuticals are very important in acute care. So when they bring you on a stretcher, you know, with a heart attack or in pieces from a motor vehicle accident, pharmaceuticals are the best. But afterwards, when you leave the hospital, this is when you actually need support. And safer support comes from medication that comes out of herbals. And when you're talking about bioidentical hormones, once you go into menopause or you have hormone imbalances, you need to supplement the hormones you're missing: estrogen, progesterone, testosterone, etc., thyroid. And you know what? You do it with hormones that are made pharmaceutically from herbs, yams, and soy.
And now we have some more herbs here. I'm curious what you have in this bowl.
Maca. This is a root that comes from the Peruvian Andes. It's actually eaten as a food. It's a very nutritious food. It's been sitting around for a while.
I'm just looking at it. Trust me, I was not going to eat it.
There's a lot of sex there.
It also significantly boosts libido. And mountain climbers in the Andes carry this in their pockets and chew on it for endurance and stamina. It's actually very good tasting. They use maca to make many, many dozens of foods in the Andes. But it has benefits. Most people focus on the sexual benefits, but it also improves endurance and stamina as well.
Now, I have to say that I have a little interest in anything like this that comes in a baggie like this. I'm sure people are wondering what you're carrying around here.
Well, this is this is Rhodiola rosea. It's a root from northern China and Siberia. It enjoys about 3,000+ years of use, many, many hundreds of human clinical studies, though most remain in Russian and Chinese. It is used by athletes. Any Northern Asian athlete in the Olympics is taking rhodiola for endurance, strength, improved mental acuity. It helps you to adapt to all forms of mental and physical stress, so altitude, cold, heat, bad traffic. It helps to bring down stress hormones in the blood. So it's a very, very valuable herb. If you travel as much as I do, and I travel constantly, I need things that can keep me even, and rhodiola is one of my sort of secret ingredients.
But you know what's very important, what you're saying is, you know, you're showing them in this form, but I think what you need to also tell people is that you can find them at the health food store, you know, Whole Foods, whatever, and you work with the industry, from what I understand, to actually create them, put them in capsule form or tablet forms, things that we are so used to thinking make sense. And these things are available, rhodiola,
yeah, you've got
maca, everything.
teas, capsules, tablets, fluids of different kinds, concentrates, you're right.
And it's important to know that you don't see them like this at your health food store.
I was wondering, that's why I asked before what you do with this.
Right, that's why I thought about it, because this way you know that you can find them at your health food store in a capsule or in a tablet.
So we have a viewer question who wants to know, can I take herbal formulas in place of medication that I'm currently on?
Well, okay, in case of medication that people are currently on, it depends on the medication. In that case, they need to consult their doctor, who most often won't know anything about herbs and will say, I wouldn't do that. So what you need to do is find a complementary medical doctor who understands herbs. Billions of people, in fact, use herbs instead of synthetic pharmaceuticals. And many people transition from pharmaceuticals to herbs, but it depends on the medicine you're on. You know, if you're on Xanax, you don't just go, oh, I'll just throw away my Xanax and take rhodiola instead. You could run into problems.
Okay. Before I let you go, I know that you have traveled the world. You have spent 40 years doing this, or in 40 countries, been around the world. You truly believe that plant-based medicine is best for humans, but you also know firsthand that it saved your life. Can you tell us how?
I was in India many, many years ago. I got dysentery, as anybody going to India will get. I lost 35 pounds. I started out at a weight that was much less than my weight now. I was having fever, chills, diarrhea, the works. I wound up in Kathmandu, Nepal, in the office of an Ayurvedic herbalist. I had no faith that this was going to work. I used herbs for sinuses and stuff. To cut it short, he gave me 2 preparations, a powder and some pellets that looked like rabbit droppings, told me to take them. I was completely suspicious of them, took the dose, the very first dose. 2 hours later, the fever was broken, the chills went away, the diarrhea stopped. I stayed on that for the days that he recommended, and that tipped me off to herbs being real lifesavers, not just for minor conditions.
No, we're certainly glad it worked out well.
Thanks.
You leave this here for us to test and try
sure.
out. Thanks so much
Sure.
for being with us, Chris. Fascinating
pleasure.
information. We'll take a short break. When we come back, we'll answer more of your email questions with our Meet the Doctors panel. Stay with us. Welcome back to Meet the Doctors, where we are going to meet the doctors literally right now, and they are going to answer your email questions. Please welcome Dr. Erica Schwartz, who was just on with us. She is an expert in critical care and prevention. We're also joined now by Dr. Ravi Rajmani, who is a pulmonologist. He too is a critical care specialist at NYU Langone Medical Center. And joining us from Skype from California is once again Dr. Lonnie Simpson, who is a bone density expert. Dr. Simpson, good to have you back with us.
Thank you.
All right, let's talk with our experts here about some common questions that you, our viewers, have asked. Dr. Rajmani, this one says, I have chronic pain in my joints and a blood test shows that I have scleroderma. I've been taking ibuprofen as per my doctor's instructions, but now I get acid reflux and I have trouble swallowing. What can I do to get to the root cause of this autoimmune disease?
So as you know, Lynn, thank you again for inviting me, but as you know, scleroderma is an autoimmune disease, and it's essentially the body is reacting against itself. While there is no single blood test that confirms the presence of scleroderma, there are certainly markers that are considered part of the picture, and your clinician makes the diagnosis of scleroderma. So as you can imagine, with any autoimmune disease, you want an anti-inflammatory or an anti-immune modulator to work, and really ibuprofen is not the right way to go. It in fact can worsen your heartburn, reflux, acidity, and it may actually make swallowing more difficult. So there are a couple of different diseases that are associated with scleroderma, but the most fearsome is esophageal dysmotility.
Now, this particular viewer said that she would prefer to go the healthy alternative versus taking a prescribed drug. Do you have any kind of suggestions for her?
Well, certainly there are healthy choices to be made in promoting esophageal health, in reducing the possibility of things that may reflux back, and maintaining the integrity of the lower esophageal sphincter. So trying to avoid acidic foods, trying to avoid caffeine, Diet Coke, as an aside, and certainly anything with caffeine, anything with any citric acid. So those are healthy alternatives.
Okay, Dr. Simpson, we have one for you. Our viewer, after watching you earlier on the show, wants to know how accurate bone density test can be.
Well, sadly, there are mistakes frequently with bone density. I'm hoping my book will change this. I have 2 chapters dealing with this issue because right now, the doctors who are the reporting doctors are not required to be trained, nor are, in most states, the technologists who set people up. So I see mistakes frequently, and it really needs to stop. I think basically bone density is where we were many, many years ago with mammography in this country. Anyone could read, any medical doctor could just say on Monday morning, basically, I read mammography, I read mammograms, and then we found out they needed to be trained. Well, we're the same place right now, bone density.
Okay. Dr. Erica, we have a question about estrogen therapy. Is it linked to increased risk of heart attack and or breast cancer?
Well, it depends. If you're looking to studies that, this study that kind of destroyed hormone therapy, the Women's Health Initiative that came out in 2002, that was using Premarin, which is a non-human identical hormone, there was an increased incidence of heart attacks in the results of the study. But over the ensuing 10 years, redoing and rereading and reevaluating the study actually came back to the fact that there is no increase in heart attacks with estrogen. Actually, if you look at young women, they have a very low incidence of heart attack, and when women go into menopause, they catch up with men at the incidence of heart attacks. So using hormones that are bioidentical or human identical will not increase, but rather protect. The worst risk for heart attack is aging.
Well, there's nothing we can do about that because the alternative is not a good one.
Right, so the thing is, so using hormones, any kind of hormones is better than no hormones.
Okay. Dr. Simpson, let's talk a little bit about vitamin D. Our viewers want to know just how important it is and whether most people get enough of it.
Well, first, I'd like to echo my support of what Dr. Schwartz just said. Thank you very much, because we really need estrogen for bone. Vitamin D, of course, is really important as well. A lot of people still are not getting the message about vitamin D. People will say to me, well, I walk my dog at 5 o'clock in the afternoon. You're not going to get vitamin D at 5 o'clock in the afternoon. There's only a certain ray that makes vitamin D, and it's around noontime when we are staying out of the sun. So to keep this very simple, 2,000 a day for most people, although I'd check with your doctor first, is safe. I prefer testing, but 2,000 a day is usually safe, and that is the amount I recommend, and often it's more than that. But without testing, I would not go above 2,000 a day, and that's vitamin D3.
Okay, thanks very much. Dr. Rajmani, how can I tell if I'm lactose intolerant? I always seem to have stomach problems after drinking milk. Is there a test that I could take that would tell me?
So certainly there are tests, but I think a common sense approach is if you certainly are imbibing or drinking lactose products and have discomfort, bloating, cramping, diarrhea at least more than 30 minutes afterwards, it's very likely that you are lactose intolerant. A quick remedy or a quick test might be taking lactose-free milk or taking lactate and see if that improves your symptoms. However, there are some tried and true methods, so you can actually do something called a hydrogen breath test where you actually fast all night, take 25 grams of lactose, and then see if you're able to metabolize it. If you don't have the enzyme lactase, the gut-forming bacteria will produce hydrogen, and that's breathed out, in addition to methane that we all produce. And there are even more complicated tests, Lynn, but try to take it and see how you react. Or stop taking it, right.
Stop drinking it.
Right.
Dr. Simpson, before we leave, can you tell us whether milk is really good for building strong bones? It's what I was taught as a child. I'll still drink it now if I have the option. Is it helping our bone strength?
I'm not a huge milk fan unless it's organic milk and it's the full fat milk. But that said, yogurt would be a better choice. And so many people have trouble with milk, and I don't really feel that milk is the best overall option in terms of calcium. We should be doing green leafies and like I say, yogurt. But again, with fat. Please don't do fat-free products.
All right, you heard it here. Go for the fat, folks. And Dr. Lonnie Simpson, thank you so much for being with us. We appreciate your insight and all of your advice. Dr. Ravi Rajmani and Dr. Erica Schwartz, good to have you with us as always.
Thanks again, Lynn.
And most importantly, we want to thank you for joining us. We're always happy to have you, and we want you to stay happy and healthy. For Meet the Doctors, I'm Lynn Doyle. We'll see you the next time.